why is it important to screen for depression? Dr. Pohl mentioned some of the reasons, but there are more chronic depressive episodes. If we don't screen for depression and find it and treat it, then there's going to be more chronic episodes, which creates more treatment needs, more impact, emotional impact on families and individuals, more financial impact on the person and the community, including the healthcare systems. It costs $81 billion per year in the United States to treat major depressive disorder. And the World Health Organization predicts that it'll be the second leading global disease burden by 2020. So continued impairment in work and relationships is another reason that if we don't screen for depression and begin to treat it, the patient becomes more and more impaired and unable to function in their work and relationships with others, families, significant persons in their life. There's also an increase in all-cause morbidity and mortality due to stroke, diabetes, myocardial infarctions, cardiovascular disease, congestive heart failure, and HIV. The risk of depression changing to treatment-resistant depression is another major reason that we need to find this disease in the beginning and treat it, because treatment-resistant depression is a total other syndrome that down the road a patient is not able to be treated any longer because they've had failures in treatment. And we consider those failures of at least 10 attempts to treat with antidepressants, ECT, and therapy without remission of the depression, the major depression. At least 10 trials of antidepressant, psychotherapy, and electroshock therapy. Is everybody aware that there's still electroshock therapy for treatment? It's a totally different thing than we see in the movies, The Snake Pit, and other things that we hear about electroshock therapy. It's a very, very small dose of electricity that is conducted. It's very effective for what we used to call agitated depression in the old days, long before most of you were around. But I remember it in the hospitals when I would hear about electroshock therapy that left individuals without memory and so forth. But it is still a very effective treatment for treatment-resistant depression. One statistic says that 20 to 30% of patients have treatment resistance, but this may be a misdiagnosis because those may be some of the bipolar patients.